I'm Dr. Chong Yun Kong from the Department of Thoracic Surgery at Seoul National University Hospital. My main job is to do adult surgery, but I also do a lot of pediatric surgery, so I think that's why I'm here today to present this topic to you. Usually, when we talk about congenital lung disease, there is a very wide spectrum of diseases. But when we talk about lung parenchymal disease, we focus on CPAM, pulmonary sequestration, CLE, and bronchogenic cyst. So we target 4 diseases. But those 4 diseases are mostly diagnosed prenatally, so almost all our patients are diagnosed as children. So if you look at the percentage of surgeries that I do, 90% of these congenital lung diseases are done in children's hospitals, and 10% are done in the adult hospital. And I'm guessing other hospitals are probably similar. So what we're going to talk about today is if you have a patient or a child with congenital lung disease, first, should you have surgery or not? And second, if you should do surgery, when should you do it? In adults, it's straightforward. Once it's diagnosed, we usually do surgery. But with children, they're usually born with the disease tagged on, so there's a little bit more of a question of whether should we do it now or should we wait a little bit longer. The last question is if we should do the surgery. How should we do it? I'm going to talk to you about all 3 of those today. Before I start the main topic, I'm going to give you a little bit of background information on what we used to do and what I used to do. When I was trained in the late 1990s and early 2000s, congenital lung diseases were very rare. At that time, we could operate on 5 or 10 patients a year in our hospital. So that was a very rare disease, even considering that we had a separate children's hospital that specialized in children's diseases. So in those days, I usually saw 1 or 2 patients a year, and even if I was trained for 4 years, I could see 2 or 3 patients for the whole training period, so it was a very rare and unremarkable disease. At that time, it was common to do a lobectomy under a thoracotomy, and because it was done in open surgery, postoperative complications were common, and the length of hospital stay was quite long. And in children, when we did a thoracotomy, it caused a problem in the development of the musculoskeletal system, and such problems and long-term growth were also common. So I was promoted to professor in 2004, and that's when I decided that I was going to try to improve these things a little bit. So I started doing thoracoscopic surgery in 2005. I did my first case of thoracoscopic lobectomy in a child in 2005, and I did my first case of thoracoscopic segmentectomy in a child in 2010. But I think the thing that made the biggest difference in our clinical practice was starting the ERAS program in 2012, which protocolized everything related to a patient's surgery, making everything predictable not only for the medical team, but also for the patient's caregivers as to what was going to happen. And now we have a system in place where everything works like cogs in a machine. Most of the new things that we're trying, I'm assuming I'm the first in my country to do, but that's not completely proven yet. So if you look at the number of surgeries, at first we were doing 5 or 10 surgeries a year, and then after 2012, when I took over the pediatric division in 2012, the number of surgeries increased exponentially, and by 2018 we were doing over 100 surgeries. At that point, I was doing so many surgeries that I was almost burned out, and I felt like I couldn't do it anymore, so I reduced the number of surgeries by 2/3. So since then, we've kept it at that level, but the problem is that the waiting list for surgery is now very long, and the waiting list is now more than a year and a half, which is not solving the problem. Anyway, this is how we are doing the surgery. In the previous lecture, you said that there is 1 CPAM for every 25,000 people, but since there are less than 300,000 newborns a year in our country, then arithmetically, there should be 10 to 15 patients a year, but we are operating more than 50 patients a year in our hospital alone. So I think that number in the textbook you mentioned earlier is not correct.